Are you tired of time-consuming hand assessments that disrupt your busy clinic flow? Imagine being able to assess hand function quickly and accurately using a simple tool you already have. That's the idea behind using a ruler to measure composite fist and opposition distances instead of each individual joint with the goniometer. In this video, I'll show you a technique that's so simple you'll wonder why you didn't think of it sooner. This technique focuses on composite measures, offers a time-efficient alternative to traditional goniometry. Busy physiotherapists need this hand assessment for every upper quadrant patient, every neck, shoulder, elbow, wrist, and hand patient. Now, I don't know where I picked up this golden nugget of wisdom, definitely not from boring school. If other physios know about this, then it's like a secret society of hand measurers, because I've never seen anyone chart hand motion like I do. Seriously, I Googled and YouTubed, and I found more videos on how to fold a fitted sheet. So here I am, ready to share the knowledge. That's why I made this video. But what about those specific joint measurements? No goniometry at all? We spent all that time in school learning how to measure all those joints. More about this later. The more patients they put on my schedule, the more I was looking for an easier way of doing things. Let's talk about composite measures. They're like the Swiss Army knife of assessments. They're versatile and they're always handy. Oh my, was that a pun? The concept of composite measures is to simplify complex data and provide a comprehensive picture of what's going on. Some other examples of composite measures you may be familiar with are the Functional Independence Measure, the FIM, to assess motor and cognitive function across 18 areas. The Berg Balance Scale to looking at sitting and standing and transitions. And the Timed Up and Go test, the TUG test. It has a sit to stand, it has walking, it has turning. I acknowledge that while goniometers offer a more precise joint angle reading, rulers can still provide a reliable and clinically relevant data to assess hand function. We need to measure fist and opposition to get a measure of how the hand is working. Is there a role for goniometry for specific joints? Sure, but you need to justify it. If you have a single problem finger, then you can use a goniometer, but the ruler measures are more functional and embracing the entire hand. Yes, I am ignoring finger extension as a functional activity. In theory, we need finger extension to open the hand, to push buttons, to push off with the hand support. But in practice, I've never seen a patient complain about this. Patients complain about a lack of flexion or opposition. They complain about the overall hand function. But in 30 years, I've never had a patient complain about a lack of finger extension. I guess it's possible. Meh. Enough talk, let's get measuring. I promise it's going to be more fun than folding a fitted sheet. For measuring a fist, simply measure from the fingertip to the distal palmar crease. Easy peasy lemon squeezy. Show your patients you're about to stick a ruler in their hand. Ask them to make a fist. Measure index, middle, ring, and little fingers. Chart in centimeters to the nearest half centimeter. Measuring fist, index is 3.5 centimeters, middle finger is 3.0 centimeters, ring finger is 3.0 centimeters, little finger is 3.0. Measuring fist, index is 6 centimeters, middle finger is 6.5 centimeters, ring finger is 6.5 centimeter, little finger is 6.0 centimeters. For opposition, measure fingertip to thumb tip. Show your patient you'll measure opposition by measuring fingertip to thumb tip. Ask the patient to touch finger to thumb. Measure index, middle, ring, and little fingers. Chart in centimeters to the nearest half centimeter. Measuring opposition, index is 0. Middle finger is 2 centimeters. Ring finger is 3.5 centimeters. Little finger is 4.5 centimeters. Measuring opposition. 4.5 centimeters to the index, middle finger is 6.5 centimeters, ring finger is 7 centimeters, little finger is 8 centimeters. There are some subtleties here. Tell the patient and demonstrate. This puts them at ease, copes with a language barrier or mental barrier like with immigrants or with kids. Chart index, middle, ring, and little fingers instead of finger 1, 2, 3, 4, just for clarity. Just like I wrote on the screen there, that's what I chart. Use a ruler that bottoms out, measure all the way to 0. You might have to trim the end of your ruler to get this. Kudos on conquering the ruler. Now let's elevate our game and dive into some hands-on fun where the magic really happens. Hand function must be measured for every upper quadrant patient, every neck, shoulder, elbow, wrist, and hand patient. This is a composite measure that mimics real-life activities such as buttoning, gripping, and writing. That's why I measure grip, fist measurements, and opposition measurements. Hand exercises are a combination of simple motions and patient activity. For hand exercises for simple motions, do a self-stretch into fist and into opposition. And I will also use a closed kinetic chain upper extremity weight-bearing activity like countertop push-ups for proprioception. Beyond that, there are tons of hand motions and activities your patients need to return to. So the best advice is for those patients to struggle to use their hand. They get the proprioception, they get the sensory motor integration, and they voluntarily expose themselves to meaningful functional tasks for their daily life. This way they will adapt to what they need to do. They can ask you as the physio for specific problems as they arrive. That's better than use of their time than stacking cones or doing a pegboard activity. Congratulations, you've unlocked the bonus round. Now let's see if you can level up. The benefit of ruler measurements are more than just numbers. It's easy for the patient to see their own progress. This is the idea of having the patients actively involved with their recovery. Patients can see their progress visually and making it more tangible and motivating. It's simple and understandable. Ruler measurements are easy for patients or other professionals or anyone reviewing your chart to understand. It's easy to relate to function, like the size of a pop can or to hold a fork or to use a key. It relates to the idea of using fat tools as part of the recovery or coping with a loss of motion. It increases efficiency. It saves time. Ruler measurements can be quicker and easier to perform than traditional goniometry. It reduces paperwork. The simplicity of ruler measurements can reduce the need for extensive documentation. You saw how quick I demonstrated those movements. I've seen firsthand how ruler measurements can make a difference in patient care. It's a simple tool with a big impact. Now go out there and make a difference in your practice. Use these techniques in your practice and share your experiences in the comment section. My 2 books are now available at Amazon. What They Don't Teach You About Documentation in Physiotherapy School, a short how-to manual for successful daily note templates, and From Injury to Recovery Through Exercise, simple functional exercise progressions for physiotherapists to restore lifting, standing, walking. Thank you for your support. Prepare to be wowed by what you're about to see, this video right here, and subscribe to embark on a journey of relentless progress. Thank you.